At what age should children start seeing a dentist? Maintaining a healthy oral health is crucial for general health, and having good dental habits at an early age is vital for long-term oral well-being. A common question parents are faced with is, what age do children need to begin seeing dentists? This is contingent upon your child's needs as well as the risk factors. However, there are general recommendations that will assist parents to make an informed decision concerning their child's oral health. The American Academy of Pediatric Dentistry advises children to attend their first dental appointment before the age of 1 or at least 6 months following the eruption of their first tooth. Although this may seem a little early to parents who are not aware of it, but dentist visits that are early in the process are crucial because of a number of reasons. One of the major reasons to have early visits to the dentist is to build a strong relation between the child and the dentist. Beginning dental visits from a young age, youngsters can develop a sense of comfort with the environment of the dental clinic and the dentist, and this can reduce the anxiety regarding dental visits to come in the near future. Dental visits at an early age also allow dentists to examine the health of the child's mouth as well as their development. When a child's teeth are examined in the early years, a dentist can spot potential concerns, like tooth decay or teeth that have been misaligned. They can also formulate a plan of treatment to take care of them before they turn more problematic. Furthermore, regular visits to the dentist at an early age are a great way for parents to learn to care for their child's gums and teeth. Dentists can give advice on the proper cleaning and flossing methods, as well as tips on nutrition and dental habits that ensure the health of your teeth. Many parents might be confused as to why they need to go to the dentist even at this young time, particularly when their child's dental health appears to good health. Yet, even infant teeth can be vulnerable to decay as well as other dental issues. Therefore, it's crucial to commence with dental appointments early so that you can avoid dental issues prior to they begin. Although the age at which children's first dental appointment is about 1 year, certain youngsters might require seeing an appointment with a dentist sooner. If a child is an increased risk of having dental issues, for example, those with a family history of dental tooth decay or another oral health issue, as well as those with specific health needs, dental professionals may suggest getting dental appointments early. No matter when the young child's first dental appointment happens, it's crucial for parents to keep regularly scheduled dental appointments throughout the course of early childhood. It is recommended that children visit their dentist regularly. American Academy of Pediatric Dentistry advises children to visit an appointment with a dentist each 6 months for regular checkups as well as cleanings. At these times, dental professionals will examine whether there are any indications of decay in the teeth, gum disease, or another oral health problems, in addition to providing advice on the best way to handle the issues that arise. The regular visits to the dentist are crucial for maintaining good oral overall health, as well as preventing severe problems from forming. Apart from regularly scheduled dental appointments, parents can encourage the health of their children by encouraging them to adopt healthy routines at their home. That includes flossing and brushing often, eating a balanced diet with a low amount of beverages and sugary food items, in addition to avoiding practices which could harm your oral health, such as sucking on your thumb or pacifier use for longer than. If they start dental visits as early as possible and by encouraging healthy oral habits by keeping their mouths clean, parents will aid in ensuring that their children remain healthy and well-groomed all through childhood and throughout the adulthood. Don't forget, it's never too early to begin treating the child's dental health. Don't put off the opportunity to book your child's first dental appointment very soon.